Blood pressure is the pressure of blood pushing against the walls of the arteries in the body. Your blood pressure is measured by two numbers called systolic and diastolic pressure. The systolic is the top number, and it represents the pressure in the arteries when the heart beats. The diastolic is the bottom number, and this is the pressure in the arteries when the heart relaxes. According to the Centers for Disease Control, a normal blood pressure should be around 120/80 or less. It is normal for your blood pressure to fluctuate throughout the day. So, you have moments during the day when your blood pressure is slightly elevated. However, blood pressure that is constantly higher than normal could cause damage to other organs in the body. Stages of high blood pressure. There are different types of hypertension based on blood pressure readings. Readings between 120/80 and 129/89 are considered pre-hypertension, which means you do not have high blood pressure, but your blood pressure is not as low as it should be based on health guidelines. Blood pressure readings between 130/180 and 139/189 is considered stage 1, and blood pressure readings between 140/90 and 179/109 is considered stage 2. Blood pressure readings of 180/110 or higher is considered a hypertension crisis and requires immediate medical treatment. There are two types of high blood pressure, namely primary, essential hypertension, and secondary hypertension. Primary hypertension typically has no identifiable cause and tends to develop gradually with age. Secondary hypertension, on the other hand, is a result of other underlying disease. For example, obstructive sleep apnea, kidney disease, thyroid problems, or side effects of certain medications. Hypertension is often referred to as a silent killer because you may have high blood pressure and not show any symptoms. However, the damage has already begun. Some people may experience nonspecific symptoms such as headache, nosebleeds, shortness of breath, which can be attributed to other conditions. Treatment. Hypertension is a chronic condition that requires long-term management. If you have hypertension, it is crucial to treat your high blood pressure to prevent long-term damage to organs in the body. The higher your blood pressure levels, the higher the risk of damage to other organs in the body, which can lead to heart disease, heart attack, chronic kidney disease, and stroke. Treatment approaches typically include dietary changes, lifestyle changes, and prescription medication. While prescription medications are effective in managing hypertension, an initial approach to the management of hypertension can focus on dietary and lifestyle changes. A well-studied health eating plan that has proven effective in managing hypertension is the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. It is a healthy eating plan rather than a diet. The DASH eating plan helps treat and control hypertension by providing nutritional goals for a healthy eating lifestyle. This eating plan is quite simple and flexible to follow. There is no special food or drink. Recommendations are simply based on everyday foods. The DASH eating plan recommendations focus on eating more fruits, vegetables, and low-fat dairy foods, eating more whole grain foods, fish, poultry, beans, nuts, and vegetable oils, limiting foods that are high in saturated fat, cholesterol, and trans fat such as fatty meats, full-fat dairy products, limiting sugar, sweetened beverages, and sweets, limiting sodium intake. High salt intake increases the risk of developing high blood pressure, and studies have shown that reducing dietary salt intake can help manage high blood pressure. An average American diet consists of 3,400 milligrams or more of sodium per day. However, dietary guidelines recommend consuming less than 2,300 milligrams of sodium per day. To put this in perspective, 1 teaspoon of table salt is about 2,325 milligrams mg of sodium, which is over the recommended amount per day. An average serving of canned soup contains between 600 and 700 milligrams of sodium, which is almost a third of the daily recommended amount. The standard DASH diet limits salt consumption to 2,300 milligrams of sodium per day, consistent with dietary guidelines. Multiple studies have shown that following a DASH eating plan, along with reducing dietary sodium intake, can significantly lower blood pressure in individuals with high blood pressure in as little as 2 weeks. An alternative version of the DASH eating plan limits sodium consumption to 1,500 milligrams per day, which further reduces blood pressure. Studies have shown that the DASH eating plan has the greatest impact on lowering blood pressure when compared to a typical American diet. Here is a recommended eating plan based on a 2,000 calorie a day diet. Along with healthy eating, there are other tips you can use to help manage your high blood pressure. Exercise regularly, aim for 150 minutes per week. Reduce stress in your life. Reduce alcohol intake. Thank you for watching this video. Hope you found this video helpful. If so, please comment below and click the like button. Remember to subscribe to the channel and hit the notifications button to stay up to date on latest videos.